Good afternoon, everybody. Thank you so much for joining us today. I hope you all had a great Labor Day weekend. For those of you that don't know me, I'm Emma Cartmel. I'm the past president of the Austin HIMSS chapter and also the founder of this chapter almost 11 years ago. I'm currently your social chair. Some of my team today are missing, so I'm jumping in to give you a warm welcome and to introduce our speaker. Before I do that, I've got a couple of announcements. The Austin HIMSS chapter is going to be having a happy hour on the 29th of September at 5:30 p.m. downtown. We're finalizing the location today, and we will be sending out the venue through our newsletter. So please save the date. They're always really well attended. We provide free appetizers and normally have a good social for about 2 hours. So it'll be 5:30 to 7:30 on the 29th of September. And that's really your opportunity once a quarter to network with your membership. These sessions are more focused on education, a little bit of time for networking, but mainly about the educational content that we present. And we also today are going to announce a couple of other events going on that might be of interest to you. The 512 Health Intelligence and Data Analytics have a meetup on Tuesday, September the 22nd, 5:30 to 7:30. And they will have a presentation on population health analytics. And then the Health Technology Forum of Austin have a user experience for healthcare, raising the bar for health technology at the Seton Clinical Education Center on Wednesday the 23rd at 5:30 p.m. And that's at Seton, which is 1400 North I-35. Obviously, they've got a lot of facilities, so I hope that's helpful. By Brackenridge. Thank you. Before I introduce the speaker, I would like to acknowledge and thank our board members that are here today. Without our board, we would not be able to pull together these meetings, lunches, happy hours. So could those of you that are on the board please stand up? Dawn, could you stand up for 1 second? Thank you. So thank you all for giving them a round of applause. I wanted you to know who they are. Dawn is always sitting in the corner, always in the corner. She's working our webinar. We actually set up a webinar. This meeting is transmitted across the airwaves to folks at Seton that can't make it to the meeting. A big warm welcome to the Seton folks today who are online for the first time. And also we have a number of CIOs from Torch, from rural communities that join our sessions so they can keep up to speed. We've got Kristen on membership. Those of you that aren't a member and would like to join, Kristen's the person that you need to speak to. And then we have Doug, who's our new vice president, who's from Seton Hospital. If you've got any questions about HIMSS in general, he's been a member for years, was the president of one of the Kansas chapters for a long time. And then we've got Jake. Can you give us a wave, Jake? And Josh. Jake is our finance and Josh is our secretary. Jake is actually looking for some volunteers. We need one more person to review our finances. As a nonprofit, we need an independent audit and we need somebody from our membership to, we have 3 people that review the books each year. It's that time of year. We're still looking for one more member to review our books. So Jake, can you raise your hand one more time? Thank you. If there's anyone in the room that's just willing to give up an hour of their time to review our books, we'd really appreciate it. Then we can get all of our finances filed for this year. Okay. It is a great honor to welcome back Tony Gilman. This is my now 4th year of listening to Tony's presentation. We invite him back every year because he's keeping us updated on what's happening with the Texas Health Authority. Tony has a great background in health IT policy. He was an advisor to Rick Perry prior to becoming the CEO of this organization. And I'm super excited to learn what's happened this year in particular because we've had the legislative session and now what's the impact to Tony's organization. So we're going to hear a lot about that today. We'd like to ask you to hold your questions until the end. Please just make a note of them. And then at the end, we're going to allow plenty of time today for Q&A because Tony always gets the conversation fired up. We want you all to participate. So we're going to allow 15 minutes at the end for Q&A. So those of you online, get in early with your questions. Those of you in the room, please make a note. Could you please put your hands together and welcome Tony?
Great, thank you. Appreciate the introduction. Is the microphone working? Everybody can hear me? Okay, well, thanks so much for inviting me to present. Like was said, I've presented for a number of years and always appreciate having an opportunity to talk to industry about what we're doing to support health IT and health information exchange, to get data moving so that data really follows the patient regardless of where they are in the healthcare system, and really to help drive, really set the, really the infrastructure in place necessary for broad-based healthcare transformation. And so I'm going to talk a little bit about, of course, the THSA and our background. I was asked to really focus on the 2015 legislative session and what we're focused on, at least during the interim. And then I'm going to touch base on HIE Texas, which is broadly what the THSA works on in terms of statewide HIE, but what's also going on at the local HIE level as well. And then I want to talk about some kind of open questions and challenges that we continue to work on. And hoping to get through the slides pretty quickly so that we can really just have some dialogue and I can address more of your questions than for you guys to listen to me talk at you. Before we get started, can you tell me who's here? I recognize a lot of people, but not everyone. So consultants and vendors, and then provider organizations. So a couple providers over here. Okay, great. So, and how many of you are familiar with and follow the legislative process as part of your job? Okay, so we have a few that do that. Great. So, for those of you that aren't familiar, the THSA is a nonprofit corporation. It was created in 2007 by the Texas Legislature to help facilitate and coordinate health information exchange. We're really guided by 4 principles with everything that we do. So we want to be patient-centric. We want to be market-based, so we don't want government getting front or getting out in front or impacting the market. We want to leverage existing resources, so we don't want to duplicate efforts. And in Texas, whether it's in healthcare or really any policy area, we really focus on regional solutions first before state level. And we provide support and coordination for our local HIEs in Texas, which includes the creation of HIE Texas, which is our state shared services network, which I'm going to talk a little bit more about later. So in terms of, I'm going to talk about the 2015 legislative session first, and then I'll get into HIE Texas. So this session was really a unique session. We had new leadership in the governor and the lieutenant governor. We had a large number of freshman members in both the House and Senate. Of the 31 Senate members, we had 10 new freshman members. And it's largely known and accepted that this is by far the most conservative legislature we've had in Texas. But despite the number of new members, if you look at if you compare the 83rd regular session to the 84th regular session, you can see that didn't keep them or slow them down from getting busy, rolling up their sleeves and filing bills and passing bills. So we saw an increase overall across the board in the number of bills filed, and the number of bills that passed in both the House and Senate for the most part. Well, at least on the House side, I'm sorry. And the Senate side, we saw a little bit of a different approach in terms of the number of bills that ultimately passed the Senate. Usually it's kind of the reverse. The Senate's the deliberative body. They pass a lot of bills, and the House is the chamber that slows legislation from actually passing and making the governor's desk. And so we saw kind of a little bit of a reversal this session. It'd be interesting to see what we see next session that begins in 2017. And we had a good session with respect to health IT and health information exchange. I'm going to talk a little bit about a couple of bills. So of course the biggest and most important one to me was that although the THSA is not a state agency, we're a creature of the legislature. And so when we were created in 2007, the legislature put in what's called a sunset provision, which they put in all agency statutes, which allows the legislature to periodically review the agency's mission to determine whether or not they have the tools in statute necessary to fulfill their mission, I think is their primary goal, but then they also review to determine whether or not the organization should be continued. So we went through that process this session, and I thought we had a very positive session. The legislature continued the THSA and really reaffirmed our overall mission. There were no substantive changes made to our statute. They did indicate that they want the THSA to become fully privatized in 2021, so 6 years from now. That was not unexpected. In fact, when we were involved in framing the initial legislation to create the Texas Health Services Authority, we envisioned out of the governor's office at the time that the THSA would ultimately become a private entity, and really wanted it to be a public-private partnership to get it started as an organization, and then to transition. The makeup of the board changed slightly. We don't have slotted positions, but the legislature felt like because we have local HIEs that we should ensure that a local HIE member is on the board. And then there was a little bit of a kind of a technical fix to ensure that we had 2 members from our Health and Human Services agencies represented as ex officio members. Previously, it had 2 members of the Department of State Health Services, our public health agency. That was a legislative really typo in the initial our initial enabling statute, so they fixed that this time around. So positive session, positive feedback from the legislature. Our bill was the first sunset bill to go through the process to be passed by both chambers. Our bill was signed by the governor before the legislative session ended, which is very unique. We were one of just a handful of bills that made it through the process that quickly. So I took that as a very positive sign that they were happy with the THSA and happy with the area and the work we've done to date. The other kind of really major piece of legislation was House Bill 2641 by Representative Zerwas. This was largely a bill that was initially considered in the 2013 session, and so it was brought back up. It did 4 primary things. The first is it focused on the Health and Human Services Commission enterprise and asked them to, as they procure new IT systems, to really procure in a way that is utilizing nationally recognized standards. And so they're going through a process right now where they're assessing their IT infrastructure and really setting forth a path that as they move ahead, these systems will be more interoperable using nationally recognized standards. And we're going to shift away from one-off instances that are unique to Texas and that require for the vendor community to have to build special interfaces with Texas. And that exists right now, and the state is moving away with that. We're moving away from that. And the agency had actually already started to move down this path under Commissioner Janik, and this legislation just kind of reaffirmed that the legislature was happy with the direction the commission was going. It clarifies that our public health agency can exchange information with providers via health information exchange network. So statute for years has said that our public health agency can do things electronically, but the attorneys at the agency really wanted it to be specific. And so this removes that perceived legal barrier. It was perceived by some stakeholders and very real to the attorneys at our public health agency. And so this addresses it. So what this means is that not only can providers through their HIA could report information to the immunization registry, the state lab, the cancer registry, for example, but they can also ultimately query it once the agency is ready to allow them to do that. That's something that providers have been asking for a while, and many providers already have connections and are reporting information to these registries at our public health agency, but we also have providers participating in health information exchange. And so if they can leverage their connection to a local HIE to report rather than having to maintain multiple interfaces, there's real value in that from a provider standpoint. So it creates, at least authorizes, the Health and Human Services Commission to consider what they can do within their programs to create incentives for HIE. And so they're supposed to do an assessment, and they determine it's feasible and cost-effective, then they are authorized to move forward with that. And so we'll see what comes of that process. And I think one of the most significant pieces of this legislation, this is a priority of the provider organizations. The Texas Medical Association took the lead on this, but it provides a safe harbor for physicians participating in HIE by shielding them from liability related to errors that aren't related specifically to their practice or anything that they did. And that was a barrier that we heard a lot from provider organizations, that they had some concerns, and it was keeping them from participating in HIE. HIE is so new, and there wasn't a lot of precedent in this space, and so that's something they asked for. It's something the legislature provided, and I think you're probably going to see more and more information coming out in periodicals that providers read, because I think this is a pretty significant piece of legislation that's going to have a really positive impact on HIE. So again, in summary, reduce the number of barriers. So agencies are going to be using national standards to make it easier for the vendor community and providers to connect. It removes a perceived legal barrier at our public health agency, and then removes a barrier that was keeping physicians from participating. So all very significant legislation, and it was broadly supported. The Texas eHealth Alliance took the lead, and it, from physicians to health plans to hospitals to home care and hospice, there was just a very mental health community, just a very broad group of stakeholders came together in support of this legislation. So again, it's always very positive when you have a broad coalition behind a piece of legislation. It kind of revalidates that there's interest in doing health IT and health information exchange, and that obviously is supportive of addressing barriers that they feel are preventing full participation. Another major piece of legislation is Senate Bill 195 by Senator Schwartner. It shifted our prescription drug monitoring program from the Department of Public Safety to the Texas State Board of Pharmacy beginning in 2016. So the prescription drug monitoring program, for those of you who aren't familiar, is a program that every state has. And under that program, providers are required to submit information to the state, letting them know that they've written a prescription for a controlled substance. This allows agencies to monitor that, particularly the Department of Public Safety, to use that as an enforcement, a legal tool, if they had concerns that providers were writing prescriptions inappropriately or too many, and that they were using their practices inappropriately to distribute narcotics. And by shifting it to the pharmacy board, it really shifts the state from a posture of law enforcement to another regulatory board, which would still have regulatory oversight, but also to a forum that really supports greater integration and provider input in the process. And so I think what we're going to see over time is greater utilization of the prescription drug monitoring program, the data that's collected, to be used for patient care, in addition to law enforcement purposes. And then importantly, the bill also permits Texas to share information nationwide through a national organization. We previously didn't have authority, our agency that was managing this didn't have authority to share that information, and that's a priority to really exchange that information nationally. And so that was an important development adopted by the legislature this session. And really, since the time I started working in healthcare back in 2005, this has been a piece of legislation that's been considered, and it passed for obviously the first time this year. So it took it 10 years to get there, but I think a pretty significant development for health IT and health information exchange and use of prescription drug monitoring data reported by providers. And then finally, there was some legislation that did not pass that related to a program that the Texas Health Services Authority operates that provides privacy and security certification to covered entities in Texas. And there were some efforts really to shift from what's a mitigating factor. If a covered entity gets the certification, they're eligible for a mitigating factor if they have a breach, to a full safe harbor. And it's really, if you want to think about how it compares, when they redid HIPAA a couple years ago, they gave covered entities really a safe harbor if the device that was lost was encrypted. And so there was an effort to try to really enhance the incentive in Texas to be proactive in working on privacy and security issues, and to shift away from heavy fines and penalties, which what we're seeing at the federal level through the Office for Civil Rights is that it's not having a dramatic impact. And so Texas is really a leader in, I think, trying to create incentives to encourage organizations to continually assess and remediate their privacy and security practices. This was an effort that came up this session, and we'll see if it comes up in next session as well. So in terms of interim activity, I didn't mention this, but all of the Health and Human Services agencies went through the sunset process, including the Health and Human Services Commission and the Department of State Health Services, and and part of that was a major consolidation of all those agencies. And so monitoring as they move forward, particularly with our emphasis on our Medicaid agency, the Health and Human Services Commission, our Public Health Agency, Department of State Health Services, that's something that we'll be monitoring closely. I think it's important for everybody that works in this space to kind of understand how they plan to move forward. Contracting reform, I'm sure I'm speaking largely to a group that understands this. It's really changed, particularly in the Health and Human Services Commission, how they're approaching procurements, how they are handling existing contracts with vendors they're working with. It's a whole new world because of some of the contracting and procurement issues that came up prior to last session. And as they move to comply with SB 20, that's something that we're going to be monitoring. We're not a vendor, but we certainly contract with the commission. We have contracts that impacts us. And then with the vendor community broadly, that's going to have, I think, widespread impact. And it's going to be interesting to see how that impacts projects, timelines, things of that nature. The 1115 waiver renewal, this is also known as the DISRUPT projects. Essentially innovation grants provided to local communities to help transform the healthcare system. The Centers for Medicare and Medicaid Services have taken a hard line against states that have not adopted a Medicaid expansion. And so it will be interesting to see how the discussion between Texas and the federal government goes on this waiver renewal and what impact that may have on health IT, health information exchange, as well as other healthcare transformation items. And then we're going to be monitoring interim charters as they're made in the House and Senate. The one I'm not anticipating a lot on health information technology and health information exchange. I do anticipate there could be the potential one on privacy and security, and I'm hopeful that it's less on enforcement and more on how we can increase the state's current approach to incentivize providers to be more active in terms of privacy and security. So now I'm going to shift to HIE Texas, our statewide HIE network, and provide a quick update. Just as a reminder, the THSA is, building a statewide network to support the exchange of patient information. as I mentioned earlier, to ensure that that information follows the patient wherever they are in the healthcare system. And we're working to do that through local HIE networks. So unlike other states that have broad statewide HIEs that manage all health information exchange, we're really focusing on local regional initiatives in Texas. And then we're supporting that through a thin layer of services called HIE Texas. And I'll talk a little bit about that now. So we have local HIE networks across the state, and they're represented around the outside of the circle. And we're providing 4 key services. 3 of them are live and 1's in development. The first is we want to support clinical document exchange between HIE networks. And we have 2 HIE networks, Greater Houston Health Connect and Integrated Care Collaboration. Greater Houston Health Connect, obvious, is in the Houston area. Integrated Care Collaboration, most of you probably know, is in the Austin area. Both are connected to HIE Texas. So what that means is a physician in Houston can query a physician in Austin and pull records across those 2 communities to support continuity of care between Houston and Austin. And it's primarily supporting, the use case of somebody moves from one community to another, or if somebody's traveling and unfortunately gets into an accident or something along those lines. We're about 90% of the way connected to Healthcare Access San Antonio, and really we're just waiting for them to load a test patient to test the last portion in our test and production environment. I'm going to skip down to the third one. We have live our eHealth Exchange gateway, which allows anybody connected to HIE Texas to query national provider organizations across the nation and federal agencies participating in the eHealth Exchange. And then, of course, we provide a federated trust framework. So we have a legal framework that supports private and secure exchange. So we're all really operating under the same rules of the road for exchange of information across the state. And then finally, on the second one, it talks about it being in development. We want to support patient consent management, and we want to do that in an automated way. One of the big barriers to health information exchange is that everybody approaches it differently from a consent and authorization policy, and that's just a fact of the way the healthcare industry works. You have different hospital systems, you have different provider organizations, you have different HIE networks that have different approaches to how they want to authorize the use and exchange of their information. That's okay. We just have to have a rules-based system in place to allow that to happen in a more seamless way. And I don't think we're too far away from industry coalescing around a standard to support that type of computerized automated consent management. We actually have a specification that we've circulated and gotten input from the community. We try to get input from through our stakeholder and outreach initiatives, but we're also just waiting for the vendor community, the EHR vendors, the HIE vendors, to really be in a position to broadly adopt something that would support that. And these are really complicated slides, but I wanted to share with you our kind of dashboards of where we are, and I'll just explain these. So if you think of the HIE being on the left and HIE Texas being on the right here, so I guess it would be your right would be the local HIEs, and HIE Texas would be on your left. That's what these back and forth arrows mean. If it's going both directions, it means we have bidirectional exchange. And so what this slide tells you is that Greater Houston Health Connect and Integrated Care Collaboration are bidirectionally connected to each other through HIE Texas. What it also tells you is that that they can currently query other states, which I'm going to tell you who we're connected to through the eHealth Exchange. Other states. They can query other states, but those other states can't query our local HIEs, and that's primarily, it's not an HIE Texas issue. but it is something that the vendors at the local level have not fully enabled. And there isn't a legal or policy issue there. It's just a matter of resources and timing, and vendors being in a position to fully implement those changes, and that's a priority for us. So, we're focusing on these local HIEs, and we have 2 connected with a third, San Antonio. So, 3 of our 4 major urban areas interconnected. Healthcare Access San Antonio is actually probably going to be covering the North Texas region as well from a technology standpoint. And so once we have San Antonio connected, we'll have the Dallas-Fort Worth Metroplex, Austin, San Antonio, and Houston fully interconnected through HIE Texas. And so that's really positive. So we're actually, ironically, more active in terms of testing and on the national level. And so we're currently in the testing process with 15 organizations. And we're fully interconnected with Inova Health in Virginia, Coordinated Care Oklahoma, which is the community-based HIE in Oklahoma City, with Presbyterian Healthcare Services, which is the largest IDN hospital system in New Mexico, and with Ocean, which is a national organization that provides health IT services to federal qualified healthcare centers across the United States. So, and then we're obviously making progress in a number of other areas as well. So obviously some very important ones for us are the Social Security Administration for disability claims determination. So if a patient wants to receive benefits, there's a lengthy paper process they have to go through. The Social Security Administration wants to use our electronic records to go from months to days in terms of making that eligibility determination. That has real value in terms of financing for healthcare organizations because there's costs in terms of managing those paper records and sending them back and forth to the Social Security Administration, but also has a human cost because for every day a patient is waiting, that has an impact on them. Veterans Health, particularly in Texas, is a significant target for us to be interconnected. Veterans Health is primarily connected to organizations directly, and so Texas case, we're a federated network, means we have multiple organizations underneath the HIE Texas network, and so this is new for them, but they're excited to be working with us. And so we spent a lot of time talking to the VHA, and we've made some substantial progress over the last year in terms of modifying their architectural and approach, and also doing some things on the Texas side to really make it easier for them to interconnect for a federated market. And we're really, they're using us really as the test case for how to connect to a federated set of organizations. And then the Department of Defense, we've really just started the path down with them, but they're obviously a key participant for Texas as well. And having these other states, and particularly these federal agencies, once they are connected, I think that's really going to increase and drive value for participation in our local HIEs, because there's a lot of interest in receiving and exchanging information with the VHA and DoD, for example, because there is a lot of health care for those 2 organizations that actually occurs in the private setting. And then we're also very focused on connectivity to our state agencies. So with a primary focus on the Department of State Health Services, we've tested one mode of transport. Hopefully we'll be able to test web services next. And with the passage of House Bill 2641 that I mentioned earlier, they're in the process of developing a project plan to support further development and testing so we can go production with them. And so I think that's a positive development for us. Having legislation and the legislature asking them to, suggesting they do this, I think really increases the focus of any agency to work on something. And then we're currently working with Greater Houston Health Connect and our PDMP program to allow providers through their HIE to query the PDMP program through a SAMHSA grant that the Health and Human Services Commission received. We've made some progress there as well. Epic is the test EHR vendor that we're working with. They've successfully queried through HIE Texas to the PDMP program, and now we're just working to add the HIE in the middle. And so we have a statement of work and a specification, and we have marching orders to all our vendors on what we need to do to make this happen. And the grant ends in September of next year, so we're anticipating a lot of activity between now and probably the July timeframe of next year. This will also help support national connectivity as well, and we're in close communication with the Pharmacy Board. So as the program shifts from the Pharmacy Board or from the Department of Public Safety to the Pharmacy Board, we don't have any concerns at this point that that's going to be what the work we've done is going to be disrupted in any way. It's all been very, it's been highly coordinated and a positive dialogue up to this point. So I also want to focus on kind of where we are in terms of local HIE development that will kind of feed into some of the open questions I'm going to highlight. So when I talked to you last, we had 10 local HIEs, and this is what our local HIE map looked like. But over the last year, and particularly from information we collect through our annual survey to our local HIEs, this is what our map looks like now. So what we're seeing is that the regions that our local HIEs were covering is changing, and we're seeing some consolidation. So I mentioned earlier, healthcare San Antonio, which is the red region, is partnering with North Texas County Healthcare Partnership, which is in the Dallas-Fort Worth Metroplex area. And so we're anticipating that we're not going to have two separate HIEs any longer. North Texas providers are going to leverage the technology platform that San Antonio is using. And they're probably, I'm also anticipating that they're going to adopt and accept their governance approach and their approach to privacy and security. We've also seen some market changes. So when I was here last, we talked a little bit about the integrated care collaboration, which is the Austin-based HIE. One of their long-standing financial partnerships, Lone Star Circle of Care, ran into some financial problems and pulled out all of their financing. That had a pretty significant impact on the integrated care collaboration. They've recovered from that as an organization, and the provider organizations that support them have been very good about working with them and helping to maintain their operations. But they've also consolidated really from what they were 40 counties that they were planning to connect, which really covered Austin all the way to East Texas. They've consolidated to about 11 counties, including Travis and the surrounding counties. And so that's a dramatic impact to Texas. Southeast Texas Health Systems was covering the Panhandle region, and they are just very much focused on some communities, rural communities right outside of the Houston area, surrounding Victoria. And then Paso del Norte, what they report is they still have a lot of interest in covering Midland and Odessa area, which is represented by the A, but they've really focused on El Paso County, and that's where their primary focus is. And so this is a little depressing, but it's where we are. And I also want to emphasize that there's also positive things going on. And I'm going to get into the numbers on the next slide, but I'm going to touch on some positive things before I get into the actual numbers. So in the Rio Grande Valley HIE, they are working under a 1115 waiver district grant with a number of organizations to support an ACO type initiative that's looking at data related to diabetes patients. So they aren't working on what we initially they were funded to do, which was to support really the exchange of patient information between providers, but they are leveraging their HIE infrastructure to support research in partnership with the University of Texas in Houston on diabetes patients. So to so that's a positive development for that community. It's something the community is behind. It's something they have funding to support, and it's not that they do have organizations that are connecting to exchange information, but they've also refocused a little bit in terms of where they're spending most of their time. And it's something the community wants, and so that's not necessarily a negative thing. The Southeast Texas Health Systems, they are involved in the National Rural ACO Initiative, and so they're not involved in exchange of patient information, but they are involved in all of their hospitals that initially sign up are interconnected to support exchange of claims information, to support analytics and use of that data for analytics purposes. And so it's not, again, clinical data at this point, but it is claims data, and there is broad participation at this point. So not clinical information at this point, but they are exchanging some level of information. In Paso del Norte, they've had some challenges with legal agreements being signed, but their largest hospital system, which really I think lays the groundwork for other hospital systems participating, has signed a legal agreement, and they're prepared to and they already have that organization technically connected. So so a positive movement there as well. I want to drive down into some of the numbers. So when we think about exchange, we think of two forms of exchange: query-based exchange, which is pulling information between organizations, and then direct-based exchange, which is point-to-point exchange of secure messages. And this is what we see in Texas right now, is we see about 4,000 physicians active on both query and direct. We see more providers signing up to use direct secure messaging services than query at this point. It's primarily being driven by meaningful use stage 2 and some requirements of providers to support point-to-point direct secure messaging. And that represents about 8% of all actively licensed physicians in Texas. So we have about 82 hospitals. We have 82 hospitals using direct, 67 hospitals on query through our local HIEs, and that represents about 12% of all of our licensed hospitals in Texas. We have some other providers, and on a monthly, that are also participating, and that primarily includes some mental health providers, FQHCs, providers participating in FQHCs, labs. Those types of providers are considered in the other provider category. On a monthly basis, through our local HIEs, there's about 17,000 transactions, and for query, and about 25,000 through direct secure messaging. Those numbers are low, admittedly, but for a large state like Texas. But if you compare them to the state of New York, which had a 4-year head start on us and hundreds of millions of dollars invested, our numbers look very favorable by comparison. So we are making progress. We see increases in the number of physicians active every month. We see some fluctuation in the number of queries, but it's either at this level or slightly higher each month. And we anticipate continued growth, particularly in some communities. Now, this is again a really busy slide, and if you want to go look at it in detail, of course I think you'll get my slide presentation. It's also available on hietexas.org. We have a snapshot, and I just wanted to show you that show this because most of the activity that we see is through FirstNet, which has transitioned really from the community-based HIE to a enterprise HIE. They're really just supporting their hospital system and organizations that have physicians that have contracts with that hospital. Greater Houston Health Connect, Healthcare Access San Antonio, and ICC. We see most of the growth right now in the Houston area and the San Antonio area. We see some activity in the Rio Grande Valley in terms of actual exchange and addition of providers. but really it's been slow across the board in the Rio Grande Valley and rural health information exchange organizations like Southeast Texas Health Systems and the HIE that covers the Corpus Christi area. So we're also very much focused on what do we do to continue to support HIE activity in rural Texas. And so we went through a procurement process and contracted with Healthcare Access San Antonio at the end of that process to do a readiness assessment in primarily West Texas to see what providers were thinking and where they were in terms of interest in adopting, using health information technology and connecting to health information exchange. We also asked them to develop a business operational plan to potentially share their technology with provider organizations across West Texas. They recently completed the readiness assessment, and it really focused on kind of the major urban areas out there: Amarillo, Abilene, Lubbock, San Angelo, and Wichita Falls. And they held focus group sessions. They conducted a survey, which really helped to inform their business operational plan, which was actually just submitted this morning to me. And again, it's just as Healthcare Access San Antonio is offering their technology platform to North Texas Accountable Healthcare Partnership in the Dallas-Fort Worth area, they're looking to do that in these rural areas as well. And what they've reported to me is that they're getting some positive feedback, not from all communities, but at least interest in exploring it. And it seems the pricing may be at a level that organizations might be willing to participate. But of course, only time will bear that out. So ongoing challenges and kind of open questions. So sustainability is not only an ongoing question for our local HIEs in Texas, but really across the nation, achieving that critical mass. We have a lot of hospital participation. We have some managed care organization participation. We have some FQHC participation, but we don't have a lot of other ambulatory participation. So we don't have a lot of physicians participating in our HIEs except for maybe the greater Houston area at this point. We don't have long-term care participating in any substantial way. And that's really, I think, an important challenge that we need to address. One of the barriers to ambulatory participation and participation by some of our FQHCs and the long-term care industry is the cost of participating. Whether it's an EHR system or an electronic system that they maintain, the cost of interconnecting those systems, and then also just implementation delays. The vendor community has really been is overwhelmed with the amount of work required not only in Texas but across the nation, and so having the resources necessary to support this growth just really is not there. I talked about level of physician and other provider participation. Most of our HIEs are really focused on really integrating their HIE into the EHR workflow. So having a single sign-on rather than having providers go to different portals to check the HIE versus their internal EHR system. But that HIEs often support that and are interested in that, but it's really up to each EHR and their capabilities to support that single sign-on or integration, and so that can be slow as well. I talked about the geographic coverage with Southeast Texas Health System, ICC. I didn't mention FirstNet, but they really covered most of Northeast Texas, kind of north of the Integrated Care Collaboration, and they've really decided that they're going to focus on their own hospital system rather than a broader community-based HIE that covers all of Northeast Texas. And then I mentioned rural Texas. That's something we're focused on, as I mentioned earlier. And so open questions that we're considering. And again, from our standpoint, we want to leverage regional services and regional organizations, but are there things that we can support at the state level, such as event notification, labs, medication history, a state level provider directory, and to augment our local HIEs. And we're being more, I guess we're looking at that more aggressively than we have in the past. Should we build connections directly to cloud-based EHR vendors so that each HIE doesn't have to do that? What is the best way to connect and receive data from the long-term care industry? Again, we're relying on our local HIEs to do this, but and we see some activity, but not enough, and we think that's critical to their success going forward. And so we may take a stronger role in that. I talked about automated consent management, and then how can what strategies can we leverage to support rural participation information exchange. So I've gone longer than I anticipated, so I want to leave some time for questions. If you want to learn more about what we're working on, please go to hietexas.org. Do you want me to read the question?
Can you hear me? All right. Okay. With the stark die-off of local HIEs and increasing white space, has there been any debate of a government-run statewide central HIE?
So I think that it's important that to note that we do have some successful regional initiatives and activities occurring. So we don't want to replace or undercut those. But when the THSA board met earlier this year, we started some dialogue. The board meets again in November. I don't want to suggest or imply that we're shifting to support a statewide HIE, but we're certainly looking at how HIE Texas and the THSA can play a stronger role in building services that would augment and enhance the value of participation in our local HIE networks. So if a local HIE is not building a connection to the major labs in Texas, if we could do that for them and they could interconnect with us, would that increase value and participation for them? Historically, some of these things are things that the HIE said they wanted to do on their own, and we wanted to respect that. So we have to walk this fine line of how do we support these local initiatives without duplicating effort or undercutting their business models and their chance of being successful. So we're going to, the questions I raised, kind of open questions, these are hard questions that we're very much focused on right now with our board of directors.
Thank you. So we're in the back.
So I don't think there's been any. So I don't think there's been any studies that really have focused on this. And so my comment is just generally, what we're seeing, despite large increase in enforcement and fines and penalties, that we're still seeing large data breaches across the United States. And so I think the Texas approach could have a real meaningful impact in really creating more incentives for organizations to regularly assess and remediate their privacy and security practices. And I'm sure fines and penalties are an important element, but also organizations often respond more, at least in my experience, to carrots than they do to sticks. And so I think there's an opportunity for Texas to lead the way, and we feel the program and the approach that Texas has taken has has some positive elements to it and could be enhanced, and that's why I mentioned that legislation.
Hi, Tony. Thank you very much for this update. In a brief conversation before your presentation, you said something about facilities not really having the incentive, certainly competitive facilities not having the incentive, right, to connect or facilitate connection with the HIE. And then also throughout your presentation, you mentioned something about EHRs, right, and so I'm trying to figure out who pays the cost of making that connection possible, and where do the incentives lie, and whether it's hospital A has EHR, whatever it is, Cerner, and needs to connect, who needs the incentive to make that happen?
So the cost primarily for, of course, EHR implementation and then HIE is borne by provider organizations largely, and there are some other participants that put downward pressure on participation in HIE, such as health plans, and their involvement, certainly that's happening in Texas, but it's fairly limited in scope in terms of major health plan financing of HIE at this point. And so it's being borne by organizations, and meaningful use does not provide any significant substantial incentive from a regulatory standpoint for organizations to participate in health information exchange, and there's no substantial financial incentive at this point as well. We still largely live and work in a fee-for-service market, and although we see some evidence of payment reform, and we know it's on the horizon, we're well out in advance of broad-based payment reform. And I think as we see, as payment reform really takes hold over the next couple of years, I think we'll see some more interest, because as provider organizations take on more risk associated with each patient, there will be more of an interest in really being able to track that patient across the entire healthcare continuum. I think that will happen over time, but we're not there yet. Not in Texas, but really not across the nation. But it's around the corner. If Medicare follows through with their intent to really ratchet out value-based payment reform initiatives over the next 2 years, 2 to 3 years, I would anticipate the large commercial payers will follow suit, and Medicaid will as well, and that will be a substantial driver for health information exchange.
Any other questions? I've got one quick one. We have about 6 minutes left. You mentioned one of the barriers on the vendor side is the inability for there to be standards as far as interchange of information. Are you familiar with the Commonwealth Health Alliance and that they're doing as far as emerging that standard that's sort of vendor-driven, and how that fits in with the whole HIE?
Yeah, I'm so glad you asked that question. So there are a number of initiatives through the Commonwealth Health Alliance, through the National E-Health Exchange, Healthy Waste Care Equality Initiative, through ONC and their partnership with the Argonauts to look at new standards to break up data in a way that would be easier to use standards that would be easier to implement from a time standpoint. And so I think there's a lot going on, and we're going to see a lot of change over the next couple of years. In terms of the Commonwealth Health Alliance in particular, we're members of the Commonwealth Health Alliance, and the reason the THSA is a member is because we want to see health information exchange go. And although it's a proprietary network, we think there's an opportunity, particularly in rural Texas, that have invested in EHR systems, vendor systems that are participants in Commonwealth, that it may be more affordable to leverage the Commonwealth integration among those vendors than it would be to have a private HIE in the middle. So we think there's great opportunity there. And if we look at rural West Texas and rural East Texas, there's just a really high percentage of those Commonwealth vendors, their products being used in those areas. And so that may be part of the solution to greater interconnectivity in rural parts of Texas. And then One of the things that Commonwealth is not currently considering, but the reason they were excited about us participating with them is we want to explore how we could, if you have a group of Commonwealth vendors interconnected, and the anchor vendors are like Athena and Cerner, Allscripts, McKesson, just to name a few, Greenway, that if we could interconnect the Commonwealth network to HIE Texas, then that would be a way to really bring a lot of providers and interconnect quite a few providers and a large number of providers in Texas, including a pretty substantial number of rural providers, pretty quickly. And so we're actively participating. I'm going to their national conference at the end of this month to really help introduce that concept of interconnecting the Commonwealth network to HIE Texas. And what we anticipate with Commonwealth is they're planning to go from 60 installs to 5,000 installs over the next year before HIMSS 2016. And if you look at their map, a lot of the providers targeted, a large percentage of them are here in Texas.
Seton's going to be one of them, for sure.
Great.
Yep. Any other questions?
What are they doing there?
So, and the HIE Texas is not going to adopt that. THSA will not adopt that. But the North Texas provider organizations have indicated through a process they went through with their original HIE and the San Antonio-based HIE that they're planning to support their current governance, and which primarily relates to how they manage consent authorization. And so the Dallas-Fort Worth area was primarily an opt-out hybrid approach, and San Antonio is more of a it's a hybrid too, but it's more of an opt-in approach. So we'll see how that unfolds over time, but that's an important element if you're talking about two organizations merging or working together, is that the provider, we have a large number of hospitals already participating in San Antonio, and so it would really slow down the progress if the North Texas provider organizations decided to take a different approach in terms of consent. And it seems like there's interest and a willingness to align with what the approach San Antonio took.
All right, thank you so much. I appreciate that. Good session. Yeah, thank you.
Thank you very much.
So as part of my job, I don't follow the legislative process too much, but this is a good opportunity once a year to see what's going on in Texas, so I appreciate you coming. Couple announcements, just kind of reiterating. And as you talked about Commonwealth, one of the standards that's baked into Commonwealth is going to be our November 10th session on FHIRE, which is the Fast Healthcare Interoperability Resources, one of the standards that's in Commonwealth. So that'll be November. And October 13th is Dr. Clay Johnson, who's the new dean of the UT School of Medicine. He'll be here next month. So